Assalamu alaikum. My name is ARSHAD and I'm presenting a case of Granulosa theca cell tumor in female Rottweiler. The patient was a 4-year-old female Rottweiler presented with the chief complaint of persistent estrus lasting for more than 6 weeks. She showed a typical sign of prolonged heat, for example, valvular swelling, bloody discharge, and behavior receptiveness to males. These prolonged signs indicated whether it was a hormonal or an ovarian abnormality, which led us to begin a thorough diagnostic workup. An ultrasound examination was performed on day 40 of estrus, which revealed a large left ovary about 19 to 21 millimeter in diameter, containing a heterogeneous hypoechoic region on the caudal pole. The left ovary, however, appeared normal. At this point, we could not yet distinguish whether it was a follicular cyst, an ovulatory follicle, or an ovarian neoplasia. However, by day 57, repeated ultrasonography showed that the left ovary had developed a distinct honeycomb-like pattern, which is a typical feature of granulosa theca cell tumors. Additionally, the uterus was noticeably enlarged and cystic structure was observed throughout the endometrial lining, which indicated cystic endometrial hyperplasia, which is a common effect of long-term estrogen exposure. Further, hematological testing was performed and elevated inhibin B level suggested excessive granulosa cell activity, and suppressed progesterone levels were found, which indicated a failed luteal function. To assess the overall health of the animal, a complete blood count was performed, in which it was revealed that non-degenerative anemia and leukopenia, which indicated bone marrow suppression due to prolonged estrogen secretion from the tumor. Taking into account the clinical symptoms, ultrasound imaging, and hormone levels, we reached a primary diagnosis of a granulosa theca cell tumor. Because of the anemia and hormonal imbalance, it was decided that the immediate surgical removal of the left ovary was necessary, both to confirm the diagnosis and to remove the estrogen source. So a laparoscopic unilateral ovarectomy was chosen as the surgical method. This minimal invasive procedure allowed for the safe removal of the affected left ovary while preserving the healthy right ovary, maintaining the dog future reproductive. The surgery was successful with minimal blood loss and no major postoperative complications. The patient recovered quickly and was discharged the following day. The histopathology of the sample confirmed that the tumor had replaced more than 80% of the left ovary and was a highly cellular, encapsulated, and well demarcated neoplasm, consistent with the granulosa theca cell tumor. On day 14 after surgery, a follow-up hormone testing was performed. The inhibin B levels had declined significantly and progesterone returned to the baseline, confirming that the tumor hormonal activity has been resolved. For 4 months after surgery, the dog returned to normal estrus, demonstrating the restoration of her reproductive cycle. To test her breeding potential, a controlled natural mating was performed on day 4 and 6 after the LS surge. The dog successfully conceived, demonstrating retained fertility through preservation of contralateral ovary. However, the pregnancy failed due to CEH due to estrogen exposure from prolonged estrus, which had damaged endometrial tissues, compromising the availability of the fetuses. It's also worth noting that the laparoscopic approach was the key to successful outcome, and it offered a faster recovery and reduced post-operative risk compared to traditional open surgery. In conclusion, this case not only highlight a rare reproductive tumor in canine, but also emphasizes the importance of combining diagnostic images, hormonal profiling, and minimal invasive surgery to achieve both therapeutic and reproductive success. Thank you.